Okay, good afternoon, everybody. This is the Washoe County District Board of Health meeting for Thursday, July 25th, 2020. We'll start today with our roll call and determination of quorum.
Chair Novak,
Here?
Vice Chair Brown,
Here.
Marsha Burke-Baylor. Absent. Christopher Dare. Absent. Dr. Rika Denko.
Could they be muted?
It's very possible. Let me double check.
And we don't have the little pictures up on the other side yet.
It doesn't say that.
Excuse us for just a minute while we handle a couple technical problems.
No, it doesn't say everyone's muted. Just give me 1 second, Chair. I'm not sure. Yeah, they're saying they're here, and I just think we can't.
Christopher says he's waiting for somebody to let him in.
The door?
No, he's at home,
Oh, okay.
on the computer.
Hey, Byron, is Byron there?
Yeah.
Is the trailer back? Kevin?
I believe so,
Okay.
but I haven't.
Yeah, this is.
Letting somebody else handle it.
You're gonna have to go in. Everybody, like individually, I guess. Could you ask
says-
Alexia to,
He says the date says May 28th. Christopher does.
he might have signed in on the wrong,
So
wrong.
he says he's gonna retry.
This is Dean. Can you all hear me?
Yes, we can.
Thank you.
Dean's on there.
Tom Young, can you hear us?
Oscar sent me a screenshot. Says he can't get on.
Okay. What does Sturgis say
Yeah,
about this? Robert's Rules of Order.
The screenshot that Oscar sent says the meeting is scheduled for 5/28/2020. Starts 1 p.m.
Ask him to access it through his agenda.
Last month was 5/28, not 5/25.
Yeah, that was, oh. Cause that's last, I think they're trying to log in through last month. Okay, Christopher Dare's in.
Says he's in, but they can't talk.
Yeah, now, can,
Hello, now I can be heard, I think.
Hey, we can hear you, Christopher.
Hey, everybody. I still can't turn on my video, but that's okay. You don't need to see me.
Hey, everybody, can you hear me?
There's Marcia.
Yes, Commissioner.
Yes.
Okay, there I am. I can't turn my video on, but
But
I'm
we're
in the
glad
same-
to have you anyway.
I'm listening and I can see you.
Oh, good. Your name just popped up. That's good. With the two of them, we've got quorum.
Yep. And I know, it sounds like Oscar's trying to get in.
Oscar's trying to get in.
okay, let's try roll call.
We could.
There's no password.
Yeah, no, there's no password.
Should just be able to hit the link and get in.
Yeah, Oscar said he used the Zoom link from the agenda. And, just can't get in because he's still stuck.
Can you text him back and see if he can use the phone ID to call in, the 669 number?
Yeah, do we have that?
It's right on the top of your
Oh, he's
agenda.
in. He's in.
Oscar, you with us?
Okay, now he could probably.
Hello.
Hi there.
Hey, thank you. Sorry, you guys.
No, that's right. Another technical problem, so we're good. Susie will recall the roll in just a minute for quorum, and I think we can get started because I know we have enough via Zoom in here to at least have our meeting.
Sorry, Chair, I'll do roll call again.
Okay, go ahead.
Chair Novak,
Here?
Vice Chair Brown,
Here.
Marcia Brupigler,
Here,
Christopher Dare,
Here.
Dr. Rika Denko, Oscar Delgado,
Here.
Tom Young.
Here.
The record will show Dr. Rika Denko absent. Chair.
Okay, good. Thank you very much. We do have quorum, so, Mr. Health Officer, can you lead us in the pledge, please?
Please join me. I pledge allegiance to the
allegiance to the flag of the United States,
and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That's got a little echo in there. Terrific. Okay, got the pledge out. Do we have any public comments?
We have no comment, Chair.
Okay, good, thank you. Moving to item number 4, which is approval of the agenda. The agenda was mailed out and made public for us. Is there any changes, anything that needs to be considered on the agenda? Hearing none. Moving on. All in favor to approve the agenda?
Make a motion.
I'll
Aye.
make a motion.
Aye.
Sorry,
I'll make a motion to approve the agenda.
I'll second the motion.
second. Okay, all in favor of the agenda?
Aye.
Aye. Aye.
Aye.
Opposed? Oh, way to go, Chris. Thank you very much. Chris has got some signs in case you couldn't see them. Okay, Mr. Health Officer, we're going to do recognition now. Item number 5.
Thank you, Mr. Chair. For recognitions this month, first I'd like to begin with years of service. And congratulations to Maria Jimenez. She has 15 years of service with the Health District as an OA2, Office Assistant 2 in Clinical and Community Health Services, so congratulations to Maria. Lisa Lotritz, our Division Director for CCHS, has got 25 years of service with the Health District. And Lisa has been doing a fantastic job, not only with keeping her division going, but with the support for the post, the work there for the medical direction of the post. And Tony Macaluso, Environmental Health Supervisor with EHS, has 30 years of service with the Health District as of the 4th of June of this month. And Tony has been actually, during the response with Ms. Albee serving as the branch or the ops chief, now in the response, Tony has been assisting with running the whole division as Charlene is working on those other responsibilities as well. We have several promotions that want to recognize. Tyler Henderson, promoted from environmental health trainee to environmental health specialist in EHS, effective May 14th. I also want to recognize Tyler's service in leading field ops with the health branch during our response. Brittany Osborne has been promoted from air quality trainee to an air quality specialist in the air quality management division, effective May 25th. And then Mervyn Dagdagan has been promoted from a intermittent hourly RN1 to a public health nurse in CCHS. So, and he's working in the immunization program. So congratulations to Mervyn. And then, as often happens when somebody gets 30 years of service with the health district, Mr. Macaluso is retiring. His retirement date will be July 6th. His last day in the office will be this Friday. And we're actually having an opportunity for people to stop by and wish him well in the A and B conference rooms this afternoon and grab a piece of pie. Of course, all socially distanced and with appropriate mask wearing. So that's what I have for recognitions today. Thank you, Mr. Chair. I should mention, I mentioned Tony's
Yes.
get together in his retirement. We did get a clock for him for his retirement. And it says Washoe County Health District recognizes Anthony Macaluso for 30 plus years of dedicated service, June 4th of 1990 to July 6th of 2020. So well deserved for Mr. Macaluso.
Tony, the whole board appreciates everything you've done for 30 years. We're going to miss you. If you want to come back anytime, we've got lots of things going on. We can find some volunteer position for you, so thank you very much. So, okay, item number 6 is the consent agenda, including the minutes from the last meeting and 8 items for consideration under the consent agenda. Is there anything that anybody wants to pull off, have a separate discussion over? Hearing none, I'll take a motion to approve the consent agenda.
Make the motion to approve the consent agenda.
I'll second.
Second.
Second, good, thank you very much. All in favor?
Aye.
Aye.
Opposed? Good, consent agenda taken care of and move on. Now to Mr. Dowell. I think I heard him on there at one point for Emergency Medical Services Authority.
Mr. Chairman and the Chair, good afternoon. You have before you our May report to the board, and I'm here to answer any questions that I can. I'd be happy to do that, and would like to add that we as an organization have been very supportive of all efforts to mitigate the COVID-19 issue. And as an organization, we continue to support those efforts in the community and the new efforts of the governor's speech last night.
Good. Any questions for Mr. Dow?
This is Christopher Dare. I have a couple of thoughts, questions.
Yes, sir.
Yeah, I just wanted to make sure, I mean, I already know how this goes and how financially things are in a normal. I'm just trying to anticipate what you guys are seeing a little bit as we go through the outcome of our economy doing what it does. I mean, it doesn't have to be today, but it would be just to kind of have an outlook. So we're looking at some real possibilities, some maybe difficulties that you're going to be facing coming, all those kind of things. I could imagine there's a few.
We are, as you can imagine, even from a national perspective, working with other organizations, both organizations like our own in the sense of being a private business and other public utility models, as well as working with city systems, so fire-based systems or third city service systems, across the country. And I will tell you that across this country, there is a concern from the pre-hospital care profession that we are going to see a continued long-term impact from COVID-19. I think across the country right now, and this is a conservative number, all systems through the month of sort of from the end of February into March into April saw significant reduction in utilization, believe it or not. And I think hospitals would voice that same picture. The utilization went dramatically down. Now those numbers are starting to come back up, but not to the level of pre-COVID. So we are, as an industry, as a profession, keeping our eye on the utilization respect. And we're also keeping a very close eye professionally on, and this goes again with work with the hospitals, with healthcare systems, as to what we're going to see relative to payer mix in the future. With the unemployment rate that we're seeing nationally and within this state, it is a very strong belief that we will see a payer mix shift here, potentially September, October timeframe, where there's a shift of some percentage from commercial coverage that we're diminishing, and that population percentage, if you will, migrating over to either no coverage whatsoever or going into a Medicaid type coverage. So I would, if it would be helpful for the board, we could put together a 1 or 2 page summary and present that to the board in the next couple of working weeks, if that would be helpful.
I'd appreciate that. For our whole region, just trying to make sure we think ahead of the things that we know affect our community so much, and what you do is one of them. So I would like that, if you don't mind.
We can make that happen. Be happy to do it.
Thank you. Is there any other questions or comments from Mr. Dow?
This is Tom Young speaking here too. I was wondering, Dean, with the increase of stress levels and all the other issues not medically related, at least in terms of a virus, are we seeing any more mental health type response issues percentage-wise in our community?
So that's a very, very good question. Let me do some homework on that, and I can shoot the board an email relative to that in the next few days. Just anecdotally going through our leadership meetings every morning at 10 o'clock, I would tell you the answer to that is yes. But let me put some science behind that and some numbers behind it to firm it up for you.
Okay, well, thank you. I mean, he can come to the next board meeting and things too as a more thorough report, but I think it's very, very important that we face the entire health of the community.
Yes, we'll be happy to do that.
Thank you.
I think that's a great comment. Any other comments, questions? If not, we're going to need a motion to accept the report.
Thank you, Mr. Chair. I'm not sure. Yeah, I think it's on. I just wanted to take a moment to thank REMSA and acknowledge their participation with the health branch and our response on COVID-19. We have Brian Taylor, bright and bushy-tailed every morning for that we do the health branch briefings. And so he's been engaged with us. REMSA has been doing the homebound specimen collection for us for COVID-19 testing, as well as running the call center operation as well. So I just wanted to acknowledge those efforts and to thank REMSA for their partnership there.
Thank you, sir.
Thank you very much.
Okay.
Chair Novak, just for the record, I wanted to note that Dr. Danko is actually logged on. She just had difficulties, so she came in at 1:15.
Good, thank you very much. Okay, we need a motion to accept his report.
I move to accept the report.
Good, second.
Second.
Second, Lisa Danko, if you guys can hear me.
Oh, yes, ma'am, thank you. Okay, all in favor?
Aye.
Aye.
Opposed? Hearing none, motion's accepted. Alexa, are you out there?
I am.
Good, thank you.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA. For the record, you have for your review the Public Relations Report for May. Today, I'll give you an update on a couple of our more recent activities. When the pandemic began, REMSA partnered with a health and wellness app that employees could use to share their health status or document symptoms. In May, REMSA worked with that company, Vivify, to announce this partnership. The story was picked up by industry print and online publications across the country. Earlier this week, REMSA hosted a press event reminding parents and caregivers about the dangers of leaving children unattended in vehicles, not even for a minute. In the United States, a child dies on average every 7 days from a vehicular-related heat emergency. REMSA Executive Director for Integrated Health, Adam Hines, and REMSA's Medical Director, Dr. Jeremy Gonda, shared statistics, tips, and information about the specific dangers for children. A REMSA paramedic crew ran a mock call with a pediatric mannequin to demonstrate the response and interventions. The story aired on all 3 local television network news channels, some multiple times. And finally, as summer temperatures continue to rise, it's important to share general information about staying safe in the heat. REMSA provided an interview to KRNV earlier this week about ways to stay cool and how to recognize the symptoms of heat-related illness. I'm available to answer any questions you may have about our public relations report.
Any questions? If not,
John, I have one. Have we thought about with REMSA and us working together at all with our new push for masks to make sure there's extra masks that we could give out as you're out in the community just to help at all? Is there anything like that going on? I just know that we assume that a lot of people have them, and I don't know if there's something we could do to help support those who don't.
Sure, that's an excellent idea, and I know that internally our EOC meets twice a week to discuss ideas and strategies like that. So I will bring that forward to the group then. In addition, I also sit on the JIC for the county, and so we can certainly talk about the coordination of some efforts there as well. But I think you're right. Our folks are out in the community all day long, every day. So that's a great connection point. Thank you.
But it might even be something we could put a message on the front that helps get out education to what we do. And just a thought. Anyway, Thank you.
anything else for her? Thank you, Ms. Jobson. I appreciate it.
Thank you.
Okay, item number 8, we're going to talk about the revisions to the Multi-Casualty Incident Plan and its annexes, the Alpha Plan and Family Services. Mr. Vicki Olson? Are you there? Ms. Olson? Is she on?
Oh, hello, here I am. Can you hear me?
There we are, thank you.
Yeah. Technical fun times. Chair, members of the board, thank you very much. This is Vicki Olson for the record. And we update our multi-casualty incident plan biannually, along with its annexes, the Alpha Plan and the Family Service Center Annex. This year was the first revision of our Alpha Plan, since this plan was just developed in fiscal year 2017 to 2018. And I'm just going to do a brief overview of the revisions that we did this year, and they are as follows. In the previous version, an MCI was declared if there were 10 or more transported patients from the scene. We did increase that number to 15 in this version due to an increase in patient capacity capabilities. Language was added for care of pregnant patients involved in an MCI. Additionally, language was added to address the possibility of hazardous materials in an MCI and to define the role of the rescue task force. Language was also added to clarify the distribution of patients to facilities during a potential or declared MCI so as to prevent one facility from becoming overwhelmed. MCI activation standards were also expanded and clarified since, as we all know, every event is different and may not fall perfectly within our activation guidelines. Hospital baseline capacity numbers were reviewed and updated. And our Alpha Plan is Washoe County's plan for exceptionally large multi-casualty events, as well as ones occurring in multiple locations at the same time, for those who are not very familiar with it. And this year was its first revision, as I previously mentioned. The definition of an alpha MCI was expanded this year to include multiple events occurring within a specified period of time, that time period being 12 hours. And finally, triggers and activation levels for the Family Service Center were updated to reflect the change in MCI declaration numbers. And I have provided copies of the MCI and its annexes for you to review, and at this time I'm happy to answer any questions you may have regarding these revisions or the plans themselves. Thank you very much for your time.
Do we have any questions for Ms. Olson? Any comments? If not, we will have to have a motion to accept the changes and the new plan revision.
So moved.
A first?
So moved.
Second?
Second.
Second. All in favor?
Aye.
Opposed? Good, thank you very much, and we do pass that. Moving on with the multi-casual instant plan. Next item on the agenda, number 9, is assessment of late fees for air quality management and environmental health services. Ms. Albee, are you around? She there? She muted? Charlene?
She's put this down. She's been doing all these.
I'm here now.
Oh, good.
I was unmuting as it was muting, so.
Oh, good. Thank you very much.
Good afternoon. Good afternoon, members of the board. For the record, Charlene Albee, the Division Director of Environmental Health Services. The report in front of you today is basically representing a continuation of the health district's support of our community as we go through the recovery phases of the COVID-19 pandemic and the guidance through the governor's phased openings. We have recognized a number of facilities that have submitted for the deferral of fees. But as we're processing and handling these and working with the industry, we realize that there are a number of businesses that are either not open, are trying to stay open, or have actually closed. So as we were juggling all of those pieces together, along with phase 1 opening, phase 2 opening, and then we're calling it phase 2.1 opening of the casinos, it was just getting to be a monster to try to manage and recognize that if these late letters were assessed on the economy and the businesses the way they are right now, it would probably not be a favorable light on the health district. And so we figured that it would probably be worth going ahead and bringing this idea forward, that we would go ahead and waive the late fees up until August 10th. That would actually take care of all 3 of the phased openings, to allow the 60 days per year directive, and would help as many people out in the community as we could. Just echoing what Mr. Young said a minute ago that we recognize the health of the community needs to be in all phases of it, and we think that this would be an investment in the economic health of our community. Noting that people that are in financial distress have a hard time making good, healthy life choices. So with that, I'm available to answer any questions.
Good. Any questions, comments?
Hey, John, this is Christopher.
Yes.
I think that sounds like a great idea. The one thing I do think I would make sure is when we're doing that is that we, in a sense, use it as a good a commercial for us in a sense of how we are helping the community and we are standing with the businesses. So we can use those things to be able to make a deposit. Sometimes we do things and nobody knows about it. It just kind of stays quiet. I don't know if there's a way to just show these are some of the ways we're standing with our community as the health board. I think that could go a long way for you.
Good. Can we do it through Scott?
Yes.
Mr. Health Officer.
Kevin Dick, we can work on that with Scott and the messaging that we put out through the media for the.
Good point, Chris. We'll take that up with our PIO and have him get the messaging out, because I think it's important, not only for us, but like Charlene said, for the financial health of it. Also, in the motion, it has a date of August the 10th. My comment would be, let's reevaluate at the end of July and see if that needs to be changed as we move forward into the next phases. So I'm going to need a motion to accept it. Do you have a motion?
This is Mike Brown. I'll make the motion to accept the report.
Okay. A second?
There, I'll second it.
Okay. All in favor?
Aye.
Aye.
Opposed? Motion passes. We'll delay the late fees for a while. Thank you very much.
Mr. Chair?
Yes.
I'm sorry to interrupt. The motion or second was to accept the report, but actually the motion should be to waive the assessment of fees until.
Good point. Thank you.
So if we can clear that.
Amend the motion to make it a motion to accept?
I'll make a motion to amend the motion.
I'll second that. This is Christopher.
Thank you. Very good. All in favor?
Aye.
Aye.
Opposed? Okay, whatever we just did, we're there and we're now official. It's still put off, so. Okay. Moving to item number 10, the acceptance of a report on Washoe County Health District Strategic Plan and Division Activities. Mr. Dick.
Thank you, Mr. Chair. And I wanted to acknowledge the work of the division directors and their staff, as well as Ms. Gutman, Dodson, in pulling this all together. As everyone's aware, we have invested significantly with our redeployment of staff in supporting our COVID response, and we will not be able to achieve all of the objectives that we had put together in our strategic plan, in our operational plans, all of the program and service delivery through the health district for this year. And so this is a compilation of all of those things that we're not going to get accomplished because of the COVID-19 response. We felt like it was important to make sure that the board was informed of this and accepting that this is what will be falling off the plate as our plate is full with the COVID-19 response. So I'd be happy to answer any questions.
Any questions, comments? Okay, do we need an action on this?
I'd like for the board to accept the
Okay.
report.
We need a motion to accept his report, please.
I'll make the motion to accept the report.
Okay, second? I need a
I'll
second.
second.
Okay, good. Thank you very much. All in favor?
Aye.
Aye.
Opposed? Where it's all passed. Thank you very much. Moving right along to Mr. Dick for number 11.
All right, thank you. Thank you, Mr. Chair. This is our update on our COVID-19 emergency response activities. I think people are aware of a lot of this through the news and through the briefings that we do in the several times a week. But I do have an update. As I'm sure everyone is aware, we had a record yesterday of 90 new COVID-19 cases in Washoe County. We have 28 additional cases that we're reporting today. So that brings us to 2,404 cases of COVID-19 in the county. We have 738 active cases. And so with the increase that we're seeing, that Clark County is seeing and statewide numbers that are coming in, we at the Health District, we're stretched very thin right now with our disease investigation and contact tracing. So we are actually bringing people back in from the field that had been pulled out of the contact tracing and those activities to help supplement, to be able to get the positives contacted, their case investigations done, and to have their contacts notified to be able to quarantine. We're also working with with UNR's Nevada Public Health Training Center out of the School of Community Health Sciences to provide staffing for us for contact tracing moving forward. And Susie has put up on the screen the rough organizational structure and staffing levels that we provided to the State Division of Public and Behavioral Health for the funding that we're receiving, the federal pass-through for staffing the post and contact tracing efforts moving forward. So we're recruiting about 30 full-time equivalent contact tracing staff. We're hoping to have the first group join us on July 6th to begin their training and shadowing and develop experience in that role, and the second group join us on the 13th, so that they're all up to speed as we have the National Guard stepping down toward the end of July. We're also working with the university for call center staffing moving forward, and for some part-time positions that will be helping with the post operations as far as directing traffic flows and some of those support activities. The post testing will be done utilizing per diem nursing staff, the intermittent hourly nurses that we'll be bringing on. And currently have 6 nursing staff in the plan, but we may be supplementing that depending on how many stations we need to be operating at the post. Those we'll be bringing on through Washoe County. We have a few other positions at through the county that we'll be bringing on, a grants coordinator that will be responsible for managing just this grant and the ELC grant. I guess it's combined with it, so it's about $10 million grant and monthly reporting requirements. So there's a lot of reporting and accountability that's tied to this funding, so that will help support that. We have epidemiologist, 2 epidemiologists that we're recruiting for right now through the county, and we're increasing a part-time statistician to a full-time statistician for support with this. The post medical operations, those nurses will be managed by the supervisor that the board had already approved for the FY21 budget. That was to help address span of control within CCHS. With this going on, that position is going to be overseeing the medical side of the post operations and those nurses. We are working with UNR for the COVID response manager, and so that will be the program manager really for all of the contact tracing and post operations, call center work, et cetera. And then we're also bringing on a couple of administrative positions to help with the supervisory roles over some of the contact tracing and call center staffing. So all that work is going on to provide us with a longer-term staffing that we're going to need moving forward until we have a vaccine available. And then we're also intending to be using these funds and that the staff involved in the post operations to be operating it as a pod, a point of dispensing, to be able to provide vaccinations both for influenza with the coming flu season, and then with a COVID-19 vaccine once that's available to provide to our community. We have been operating the post and providing community-based testing. We had a big event June 1st, that week of Monday through Saturday, where the post was opened up to anybody in the community that wanted to get tested. We actually continued to provide open testing for asymptomatic individuals to be tested through the post until last week, when the lab had become backed up, the state lab, with a lot of samples coming in, particularly from correctional facilities across the state. So in order to let the lab work through that backlog, which they did, we restricted it to just symptomatic individuals tested through the post. It's now back open for asymptomatic individuals. We have a filter within Acela that we can turn on or off as far as people going through the website portal and being able to get scheduled if they don't have symptoms. And we'll monitor that. We want to make sure that we're maintaining sufficient testing capacity for anybody that's symptomatic, as we're seeing increasing cases going on. But right now it's open for everyone. We also have had several community events, other community locations. We partnered with Truckee Meadows Fire Protection District, who held a community-based testing event up in Gerlach. We partnered with the North Lake Tahoe Fire Protection District and the Incline Village Community Hospital for a testing event. It was quite successful up in Incline. The health insurance, Anthem Blue Cross, held a community-based testing event at Reed High School yesterday, Tuesday of this week. And Health Plan of Nevada, we've partnered with, and they're going to be providing testing on Friday and Saturday of this week, 9 a.m. to 2 p.m. at Miguel Ribeiro Park down off Neal Road. So we've been doing a lot of testing. Over the course of the month, it's on average, about 750 tests per day coming out of Washoe County. To date, since the COVID outbreak began, we've had 46,713 tests conducted in Washoe County, and that's about 9.75% of our population that would represent it. So we have quite a lot of testing that's occurring, and we're also working with our nursing homes, assisted living facilities, and our first responders in providing test collection kits for those that have medical directors to be able to do the testing and submit those to the state lab for their results. June 9th and 10th, conducted the testing for the seroprevalence study, where we collected the serology samples for the antibody test run by the Nevada State Lab. There was a huge push the weekend before where we had staff out door knocking in some of the census tracts that we did not have participation from yet, to try to make sure that we had better participation in the study to improve the quality of the results that we get out of it. We did have 233 people that came through for the testing for the antibody test, and the UNR researchers are working on the data analysis on that right now. So I hope to have some results to be able to provide to our community soon that would tell us what the extent of COVID exposure had been in the community as of that date that we did the collection. So I did want to highlight a comment that we received on the post operations. I think this reflects the quality of the work that the health district has done in putting that operation together and trying to continuously improve it. And it says, I just got back from the Washoe County Health Department to take my COVID-19 test. I was extremely impressed with the military precision they operated. Every person executed their duties professionally. The signage, cones, and traffic cops, a term for people directing traffic, not actual cops, directed me to the appropriate place. I never felt confused or lost. The few who did not have masks on were smiling, and the troops and civilians alike were on their A game. Even though I was 15 minutes early for my appointment, they checked me in, processed me, confirmed who I was, and either directed me or led me to the right place. The young man who took the test gave me reading material, explained the period for the results, and I was out of there in less than 10 minutes total. I have planned and coordinated a lot of large events, such as the U.S. Army Humanitarian Depot during Hurricane Andrew, 2 base closures, plus the opening of the world's largest electronics and appliance store. The organization and execution of this event was flawless. Please pass on my compliments as a retired Army logistician to the appropriate offices if the opportunity presents itself. So I think that's high praise coming from somebody with that experience and background.
No, it's good to have something like that, especially with somebody with that kind of background and experience, so.
Yeah. And so the budget that we have provided for the federal funding for the post operation and our contact tracing, et cetera, is it covers us over a 24-month period, so through June of 2022. And we did reposition the post from the west side of the Reno Livestock Event Center over to the southwest corner, which will allow us to have it remain at that location and not conflict with other Reno Livestock Event Center operations over that time period. So we had a major move and redesign of the post, and we've been fine-tuning it now. It's in its new location. So that's my update. Be happy to take any questions.
Good. Any questions, comments, or anything else for Mr. Dick?
This is Tom Young here. I really want to congratulate you guys for doing a good job with getting these out there too. And I'm also very interested in seeing how this antibody testing goes from the month and forward and things there too. You see how we're progressing in that front.
Good. Any other comments? If not,
Yes.
Go ahead.
Yeah. Just real quick, I want to, there's a lot of things to commend. I mean, this is obviously a crazy time and a lot of leadership skills are moving and going. One of the most important things I think we've played the role of is keeping everybody at the table from Sparks, Reno County, everybody, and bring it all together. It doesn't mean that's always been easy, and it doesn't mean it will always be easy, but that table is important. So good job on that. And thank you for continuing to keep that a priority, is that we're doing this together. This is our region and our community, and we have to do that. So, but good job, staff, and good job, everybody. And hopefully we're staying healthy and safe ourselves, especially mentally and in that sense too. So hopefully people are taking the vacations they need and the time they need to make sure they're healthy. So good job, Kevin.
Good. We're going to accept this report also. So do I have a motion to accept the report?
This is Brown. I'll make a motion to accept the report.
Second? Okay. All in favor?
Aye.
Aye.
Opposed? None?
Aye.
Good. Thank you. We're all in favor of this one. Moving on. I do want to acknowledge the report and also Mr. Dick for spending numerous hours doing things that you think you're doing one thing 1 minute, and pretty soon there's 3 phone calls with something else. It's been juggling numerous balls in the air at one time and fixing a plane as we're flying it. So good job, guys. Yes.
At the same time, if I could, Chair, to make a comment, we're really looking at everything you've been doing here when it comes to the COVID response, but there's so much more you and staff have brought to the table. I know the evaluations that have been taking place for the different graduations that take place throughout the entire county, our university system, our school systems, and we need to thank everybody, and Kevin, you, for the direction for getting that done, because I know those phone calls were coming to you as well. So thank you very much for making those a success.
If I could just
You just go
quickly
right ahead.
comment. The health district staff have been magnificent throughout this. So I think we need to recognize that, and that the work that we did on accreditation, I think, is paying off. You may not see it directly, but I think that we challenged everybody in the organization through that process. And what I've seen is they've stepped up and met every challenge that we faced through this. So, thanks.
Good. Thank you all very much. Moving on to staff reports, Mr. Vega. Francisco there?
Can you guys hear me now?
Now we can hear you, thanks.
Yep, perfect. Thank you, Mr. Chair, members of the board. Francisco Vega, Director of Washoe County Air Quality Management Division, for the record. I don't have anything to add to what has already been reported, but I'd be more than happy to answer any questions.
Any questions, comments? If not, thank you, Mr. Vega. Ms. Lockridge. Miss Lisa, are you there?
I am here.
Good.
Hi, this is Lisa Lottridge, Division Director for Community and Clinical Health Services. I do not have anything to add to my report, but I'm happy to answer any questions.
Good, thank you. Any questions for? Comments? Good. Thank you, ma'am. Okay, Miss Albee.
Good afternoon. Can you guys hear me?
Yes, ma'am.
I am going to keep the ball rolling and say I don't have anything else to add. Just want to, again, recognize the environmental health staff in addition to all the other staff members that have been supporting the COVID experience.
You bet. You guys.
And I'm available if you have any questions.
You guys have done a wonderful job, and not knowing what job you're doing the next morning is a big deal, so thank you. Okay. Miss Epp, are you there?
I am here. Can you hear me?
Yes, ma'am.
All right. So Andrea S., Acting Division Director for Epidemiology and Public Health Preparedness, for the record. I have nothing to add to our report that's already been provided to you, but I'm happy to answer any questions that you may have.
Good, thanks, Randy. Any questions for Andy? Hearing none? Thank you, ma'am. Same thing, you've got a great division that's got a lot of things going for us, so thank you again. Okay, Mr. Health Officer, time again.
Yes, thank you, Mr. Chair. Just wanted to highlight we are starting to dust off the community health improvement plan and trying to get back to engage with some of that. One of the things we're not doing this year is that community health needs assessment, so we're continuing on with the priorities previously identified from the last community health needs assessment, and we'll be bringing back a Community Health Improvement Plan version 3.0 for you later this year to map out activities and objectives through calendar year 2021. And then I also just wanted to acknowledge all of the work that all my staff are doing. I have our staff as well redeployed to support the COVID response. But Scott Oxerart, our communications manager, who's now leading the regional JIC, and the tremendous amount of work that has been done by him and through that group in communicating and messaging to our community. There was I wouldn't even call it a short novel that was put together of all of the different outreach initiatives and messaging that's occurred. So I just wanted to recognize him as well. Thank you.
Thank you very much. Item number 13, board public comment. Do we have any comments?
No comment, Chair.
Good, thank you.
Item number 13 was board comment.
Yeah. I put them out of order partly for a reason. It's time for board comments to go around, see what you think, what you may have something that you need to hear from us and from the whole staff for the next month. So, anybody have any comments, questions?
I have one comment.
Okay, sir.
I wanted to make sure we're looking at these grants that we tend to get. Are there any grants that we are, I don't know, it just might be something in the future. Anticipate if we think some of these grants might start not happening because of some of the federal and different things happening, it might be worth us looking at. I know we got our report and we're looking into next year, but some of those are relying on stuff that may not be in place. So,
We'll report on that.
Okay. We'll check on that and give a report for you next time. Any other comments, questions, comments? If not, I want to take the time to thank the whole staff, everyone, top to bottom. This has been absolutely an amazing adventure. None of us necessarily needed the adventure, but we have. We've learned a lot, we've seen a lot, we've done even more than all of that. As you can see by the letter we got, people do notice what we're doing, and we're quiet. And under that, people do notice, make sure all of us wear our masks all the time, because people do notice, and they do know that we're on the health department. And even the governor said, whoops, I missed. We are gonna miss once in a while, but please do that. It's very important to all of us. The people that have been on the morning calls, the briefings, it's on Tuesdays and Fridays. Just a reminder, they're not to be recorded, and the idea is not to share them with the outside people. That's for our consumption and our consumption only, to keep everybody on the same page. So with that, thank you for doing a Zoom meeting again. It always is a fun challenge. We will see you all next month on the last Thursday. We don't know how yet, but we will have a meeting somehow.
So do we need to make sure on public comment?
Yeah, we did public comment.
Okay.
Okay, good.
Okay.
Unless I hear anything, meeting's adjourned.